So I'll be going over the modified Buffalo Concussion Treadmill test, which we use to assess exercise tolerance after a concussion specifically, but it can also be used for other populations, like if you're becoming dizzy with exertion, like with walking, jogging, biking, running, anything that's going to increase your heart rate. If you're getting symptoms of dizziness, headache, fogginess, nausea with those type of activities that increase your heart rate, we can do this test to help determine where your heart rate threshold should be when you're exercising and at what point do you start to have symptoms during exercise. So for this test, we start walking on just the level treadmill at a certain speed, just depends on the person, but it's usually anywhere from 3 to 3.6 miles per hour. So just, casual walking speed for most people. And then what we do is we gradually increase the incline. So the speed doesn't change until the very end if you get to this point of the test. But after each minute, just about, we assess your heart rate and your symptoms. So if you start to have more of a headache or more nausea or more dizziness or fogginess, we'll make note of that. And then we'll also record your rate of perceived exertion, or how tired do you feel during that part of the test. And then if you choose to stop the test, or if your heart rate goes up too high, or if your symptoms go up too high, then we stop the test and then we determine, based on the highest level you were able to achieve, what your heart rate threshold should be when you're exercising, because after a concussion, you really need to be performing as much aerobic exercise as you can tolerate without increasing your symptoms. So this gives us a real objective way of seeing what can you tolerate, what's a safe level for you to be performing activity so that you can progress and heal.